Can you get pregnant on the first day of your periods? Can you get pregnant on the first day of your periods? Gerald Massa, the Health Educator, is the name of the channel, and today we are answering the question, is it possible for you to get pregnant on the first day when you see your periods? We are answering the question, is it possible for you to get pregnant? Can you get pregnant on the first day of your periods? We are answering this question after this message. Keep watching. Thanks a lot, my friend, for watching our video. Today we are answering the question, can you get pregnant after on the first day when you see your periods? So we shall remind ourselves that when we look at this is the reproductive system of a woman, we have follicles or egg cells in here. These are the ones which are released, and then on fertilization they form a zygote. They form that cell which is called the blastocyst, which comes and attaches itself on your uterine wall, on your uterine lining. We call this implantation, and then growth takes place, becoming a baby. So to answer the question, can you get pregnant on the first day of your period, we shall first of all take this as an example. If you see your periods on any particular date, for example, if you see your periods on 9 being your first day, we know that you have to count 14 days, and on the 14th day, that is when you are most likely to get pregnant. So to answer the question, can you get pregnant on the first day of your period? It's not really possible for you to get pregnant on the first day of your period. The main reason is that on the 14th day, that is when you are ovulating. That is when the chances of getting pregnant are very high. So on the first day, your periods are coming out, but it is really not possible to get pregnant on the first day, because the first week, the first day followed by the second day, the third day, and the fourth day, if you spend 4 days in your periods, normally there's shedding of blood, there's basically menstruation happening. So it's not possible for you to be pregnant, because that is not the period, that is not the time when you are ovulating. The only time you can get pregnant is when you are ovulating, and normally that is on the 14th day. And specifically, during the process of ovulation, there is a release of several hormones, but we shall talk about two main hormones here. The first hormone is what we call estrogen, and then the next hormone is progesterone. And also there's another hormone which is very important, and it is known as the luteinizing hormone. So the only way to confirm whether you are able to get pregnant is by using what we call the ovulation predictor kits. These can easily be got in any nearby pharmacy near you, and these can easily be used. They look like pregnancy test strips, but they can tell whether you are in your ovulation or whether you are about to get pregnant. So to maximize the chances of getting pregnant, if we take an example of 24th, if this is the date you are ovulating, we always advise that you be with your partner at least 1 day before your date of ovulation. The main reason is that the hormone known as the luteinizing hormone is actually very high when you are about to go into ovulation date. If you are about to enter your date of ovulation, then normally we advise that you be with your partner. So the only time you can get pregnant is during ovulation, 3 days before, 3 days after. That period you can easily get pregnant. If at all you are on your first day of your periods, it is not possible for you to get pregnant. And remember, this is Gerald Massa. Can you have fertile cervical mucus but not ovulate? Can you have fertile cervical mucus but not ovulate? In this video today, we are going to answer the question, can you have fertile cervical mucus but at the same time not ovulate. Gerald Massa, the Health Educator, is the name of the channel. I'm really so happy to talk to you, my friend. Thank you for subscribing. You'll be able to get new videos I put out every day about women's health, about fertility, infertility, pregnancy related topics. On this channel, Gerald Massa, we talk about women's health. So in today's lesson, can you have fertile cervical mucus but not ovulate? We are going to begin by defining what we mean by the term ovulation. Specifically, ovulation is the release of an egg which is mature, and this happens on the 14th day. If we take an example of this calendar, assuming we are using basically an example, if you saw your periods on day 3 and then on day 4 and then on day 5, what happens is that to calculate your ovulation date, the day you are ovulating, you specifically begin counting from day 3, and you begin counting. We take the first day you saw your periods to be our day 1, and then we shall say 1, 2, 3, and then we shall proceed and count up to 14. So this is 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So if you saw your periods on day on 3rd, that being our day 1, your ovulation date is 16. So ovulation means chances of getting pregnant are really increased. The chances of getting pregnant, or the day you are most likely to get pregnant, is what we call the ovulation day, and it's basically the 14th day from the first day you saw your period. We are using this as our background study to answer our question, can you have fertile cervical mucus but not ovulate? Having understood ovulation, that this is the release of an egg which normally happens on the 14th day, an egg begins an egg is released when it actually is really small on the 14th day, and then it goes on. Actually, an egg begins growing during the follicular phase, and then it begins growing, and then it goes on until it becomes a mature egg. So on the 14th day, it is actually called the Graafian follicle. So when this egg has been released, it normally lasts for only 12 to 24 hours. When an egg is released during ovulation, it lasts for only 12 to 24 hours. So to answer the question, can you have fertile cervical mucus but not ovulate? It is very possible for you to have fertile cervical mucus but at the same time not ovulate. What we need to ask ourselves is this: what could be causing this fertile cervical mucus to be released but at the same time not ovulate? There are many causes for this, but we shall explain the most important causes of you seeing your fertile cervical mucus, which is actually the color of watery raw egg white. So when you begin seeing a discharge which is watery and then it is having raw egg white, normally that is a sign that you are actually ovulating or you are about to ovulate. But there are some women who will see the same discharge, have fertile cervical mucus, but at the same time not ovulate. Remember, we said that the whole process of ovulation is controlled by two hormones. These are the follicle stimulating hormone and then the luteinizing hormone. So if at all these hormones are not being produced in sufficient quantities, there's going to be, your body will begin making the changes, your body will begin making the changes of ovulation, but the whole process of ovulation will not happen. It will not happen. So you actually will be able to get a rise in the temperature. You will actually also have that cervical fluid which will increase, but ovulation may not take place. This is also known as anovulation, failure of ovulation to happen. Normally it is due to the body having issues. For example, if a woman has a disease of the ovaries known as polycystic ovarian syndrome, abbreviated as PCOS, it actually can make you to feel as if you are ovulating. You will get the signs of ovulation. The discharge, the watery discharge will come out, but ovulation may not happen. As a result, getting pregnant becomes difficult. So if you have tried to get pregnant, you calculate your days very well, you ovulate, but at the same time you do not get pregnant, it is high time you may actually need to go and talk to your doctor or your reproductive endocrinologist or fertility expert, who will request some tests to be done on you. And the commonest tests that are done include the pregnancy or the pelvic ultrasound scan, and then also the fertility hormonal screen test, whereby hormones are checked to really assess their levels in your body. The hormones that are normally tested are progesterone. Progesterone normally increases after ovulation. Progesterone increases immediately after our ovulation, and then this hormone is supposed to increase because it is a pregnancy-friendly hormone. Progesterone rises because it is preparing the body, it is preparing your womb for the fertilization or the fertilized egg that happened, the fertilized egg that is coming in from the fallopian tubes. So if you see your fertile cervical mucus, we know that you are ovulating. But if we go ahead and then test for progesterone, and then the levels of progesterone are very low, and yet we know that progesterone is supposed to be high, indicating that ovulation has happened, the next step is pregnancy. So if we test for your ovulation, we test for your progesterone levels, and immediately after you've ovulated and the levels are low, then it means you could be having a problem, whereby treatment can be given. The other hormone that is tested is the follicle stimulating hormone. Sorry about that. The other hormone that is tested is the luteinizing hormone and the estrogen hormone. These are also very important in determining ovulation because they tend to rise when you are about to go into ovulation. Luteinizing hormone and estrogen rise when you are about to go into ovulation, and then after ovulating or on the ovulation date, they peak, they rise so high, but immediately after they also tend to go down. So can you have fertile cervical mucus but not ovulate? The answer is yes. You can have fertile cervical mucus but not ovulate. It is also known as anovulation. The best advice is your doctor will order or will request a pelvic ultrasound scan, and then also your doctor will request fertility hormonal screen tests or a test of your hormones to determine the cause. The good news is that if at all you go and get these tests done, if you do the pelvic ultrasound scan and then you also have your hormones checked, normally the cause can be identified. If it is found out that you are having polycystic ovarian syndrome, still treatment can be given and you can go on and get pregnant and have successful pregnancies. If you sit back and you say you are not going to get assistance, maybe you put the blame on yourself, or you put the blame on your partner, normally this may not be good because there's always a timeline, and when a woman makes it to 40-45 years, normally you may never know, maybe if at all you had got assistance, probably you might have maybe gone on and got pregnant. So seeking for assistance, Hello, welcome to our channel. Today we are talking about the early signs of pregnancy. What are the early signs of pregnancy? You are pregnant and you suspect that you could be pregnant, but what are these early signs to confirm that you are pregnant? Gerald Massa, the Health Educator, is the name of the channel. Remember to subscribe for new videos every day. So stay with me as we talk about the early signs of pregnancy after this message. Hello, welcome to our channel. I'm Gerald Massa, the Health Educator. On this channel we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. Thank you for waiting on. Thank you for listening to our message. So we are going straight away to our first sign of pregnancy, and the first sign of pregnancy we are going to talk about is what we call tender or swollen breasts. Tender or swollen breasts. In most cases, when we talk of tender or swollen breasts, specifically we are talking about your breasts becoming painful and also increasing in size. What causes the breasts to become painful and even increase in size? The first thing we need to understand is that the whole process of pregnancy is controlled and regulated by the hormones in a woman's body. So when we talk of the hormones, these are basically chemical-like substances controlling how the whole process is going to go on. So the key hormones we are talking about here include the HCG, or the human chorionic gonadotropin hormone, and then the estrogen hormone, and then also progesterone, and lastly prolactin. These four hormones, when they are actually increasing in size due to a woman getting pregnant, when these hormones increase in their levels, they increase in their levels, normally they tend to bring about the changes which basically include the tender or painful breasts and then also swollen breasts. So our first early warning sign of pregnancy is tender or swollen breasts. Let me know if you have any questions down below in the comments. Ask your questions and I will answer them right away. I'm called Gerald Massa, the Health Educator. That's the name of the channel, and we shall move on to our next sign of pregnancy. Our next sign of pregnancy is itchy nipples in early pregnancy. When a woman gets pregnant, the increasing size of the breasts brings about increase in the elasticity of the tissue, or the skin that is around the nipples tends to enlarge, and it tends actually to increase in size. So increase in this skin normally brings about itching. That kind of like increase in the size of the nipples specifically is the main reason why the nipples begin itching. So when the nipples begin itching, just know that due to their increasing size, the increase in the elasticity of the skin is the main thing that brings about the itchy nipples. So pregnancy sign number 2 is itchy nipples. Our first point was tender or swollen breasts. We shall move on to our next early pregnancy sign. Spotting or implantation bleeding. Spotting or implantation bleeding specifically occurs when a woman gets pregnant. The fertilized egg travels through the whole journey of the fallopian tube. Remember, fertilization takes place specifically most commonly in a part called the ampulla, that is kind of a junction of that fallopian tube. So when this fertilized egg travels the whole journey up to the uterine lining, also known as the endometrial lining, and it attaches itself on that wall, what happens is that there's what we call burrowing or digging. Imagine like you're digging into the soil. So when this fertilized egg is digging onto the uterine lining, there's rupture of blood vessels, also known as lacuna. So the rupture normally, or the burrowing of this fertilized egg, the attachment of this fertilized egg onto the uterine lining brings about release of some small drops of blood, also known as spotting. So this can also mean these signs we are talking about could also mean something else, but specifically today we are covering pregnancy. So whenever you see little drops of blood on your knicker. On that period when you are supposed to see your periods, maybe you go in your periods for 2 to 3 days, but you do not see your normal periods, but you get some little spots on your knicker, then that is a confirmation, or it could be one of the early signs to mean that you are, or you could be pregnant. We shall move to our next early warning sign. High basal body temperature. High basal body temperature specifically means your temperature, your body temperature will increase when you are pregnant. Remember, the basal body temperature or your normal body temperature tends to rise. It tends to increase around day 14 of your cycle, meaning that is when you are most likely to get pregnant. On day 14, you count 3 days in front, 3 days back from your last normal menstruation date. That is specifically your ovulation period. So on day 14, the body temperature increases, but when you do not get pregnant on day 14 and you are nearing your periods, the temperature will go back to normal. But in a woman who has got pregnant or in a confirmed pregnancy, what happens is that the temperature does not come down. The temperature does not fall. It keeps rising. So when you get that temperature rising at the end of the month, you should not worry about maybe it could be a sickness. No, the first thing is wait. If at all you miss to see your periods, then you can always test. Yeah, you can do the urine pregnancy test at home to remove all the worries. We shall move on to our next early pregnancy sign. Tiredness or feeling weak, feeling tired all the time. So our next early pregnancy sign is the feeling of tiredness. You feel weak all the time. Remember, this could also be a sign of your premenstrual periods, or it could be a premenstrual symptom like we talked about in our previous video. If you missed this, if you missed the lectures, then the lesson on premenstrual symptoms, you can go to our video library and the videos are all there. We've uploaded all the videos there. You can go and watch all our videos to learn more about premenstrual symptoms, the difference between premenstrual symptoms and of course like pregnancy. So the point we are talking about here is that when a woman has just got pregnant, there's increasing fatigue, there's increasing tiredness, and normally this is due to the increasing surge of hormones, the increasing levels of hormones that are circulating in a woman's body. So increasing tiredness or fatigue is one of the early pregnancy symptoms. Headaches, and actually a woman who has just got pregnant tends to experience lots of headache, and the main reason why the headaches tend to increase in a woman who has got pregnant is because the hormones estrogen and progesterone specifically tend to stimulate the neurotransmitters in the brain. Neurotransmitters are special parts of the brain that specifically tend to transmit messages in your brain. So the high levels of estrogen, the high levels of these pregnancy hormones simply are the estrogen and progesterone. We shall simply call them pregnancy hormones. So when a woman has just got pregnant and the pregnancy hormones are circulating in the body, they tend to stimulate the neurotransmitters, or they tend to stimulate those centers in the brain called neurotransmitters, bringing about headache. Early pregnancy symptom, we are also talking about nausea. Nausea is one of the biggest early pregnancy symptom. The main reason why nausea is being talked about here is because when a woman gets pregnant, the hormones specifically known as the HCG hormone, the estrogen, progesterone, and luteinizing hormone tend to undergo lots of changes. The most important hormone we are looking at here is progesterone. It tends to be produced in high quantities when a woman has got pregnant, the hormone progesterone is produced by the placenta. When she has just got pregnant and the placenta has not yet formed, the hormone progesterone is always produced by the corpus luteum. So when we have all these hormones surging, increasing, they bring about nausea. Nausea can be managed very easily by trying to actually go for bland diet foods or go for foods that are not so oily. You could also eat more of crackers. Some ice cream will do. Some ice crystals, plain water ice crystals can help. And then also you could get some little ginger, put in hot water and take some. It can also help with the nausea. So pregnancy symptom we've talked about here is nausea in pregnancy. Frequent urination. When a woman gets pregnant, what happens is that there's lots of blood flow to the pelvic area. There's lots of blood flowing because there's something new happening in the uterus. So increased blood flow to the pelvic area puts more strain onto the whole urinary system, bringing about an increase in the urination or frequency of urination. But remember, this could also be a sign of infection. Always, if you are getting frequent, you are urinating frequently, contact your doctor so that some tests can be done. For example, the urine analysis test to confirm whether it is an infection or it could even be diabetes. So, but here we are talking about pregnancy. We shall stick to pregnancy. When a woman experiences lots of frequent urination, then this could be a pregnancy symptom. The other reason of a woman experiencing frequent urination is that when the uterus is gravid or when the baby is beginning to form in the uterus and growing, you will discover that the increase in the size of the womb puts pressure, or it actually presses onto the urinary bladder, and you discover that some little water taken, or when you consume some little water, when you drink some little water, what happens is that the urinary bladder, since it is being compressed on by the increasing size of your womb, there will be lots of urination. Backache. A woman who has just got pregnant normally experiences backache. The main reason is that the hormones we talked about in the beginning, that is estrogen and progesterone, tend to cause the ligaments to actually kind of like be very painful, and it's more of like a change in your body that normally cannot be. This is a normal thing that happens. So backache can also be due to specifically the increasing size of the womb putting strain on your spinal cord or putting strain on your backbones. So you do not need to worry if you are experiencing backache. Just know that this could be pregnancy. You can always go have the pregnancy test done, but you could also talk to your doctor if the pregnancy test is negative and you are still experiencing the backache. It could be due to overworking, overstanding, or even carrying heavy things. We shall move to our next early pregnancy. Food cravings. When a woman begins craving for particular types of foods, for example, ice cream, and also maybe pickles or any particular type of food cravings, this could actually mean that you are pregnant. Always, it's recommended that when you begin craving for certain rare types of foods, then it's very important that you confirm by having the urine pregnancy test being done. Thank you, and we shall move to our next. Food aversions. When a woman begins getting food aversions, a heightened sense of smell, an increased sense of smell to particular types of foods, then we can actually begin thinking of pregnancy. The most important thing we can do is the urine pregnancy test to remove any worries. Mood swings. Mood swings specifically are due to the hormones estrogen, progesterone, luteinizing hormone. When these hormones are increasing in their levels after pregnancy has taken place or after fertilization and implantation has taken place, these hormones normally change to bring about these mood. They tend to bring about these mood swings. But remember, as the pregnancy progresses, these mood swings can also reduce. So when you begin getting mood swings, previously you were a happy woman, but now you get turned off very easily, you get annoyed very easily, then consider having a urine pregnancy test or have a pregnancy test done to confirm this could be a pregnancy sign. Cramps. Cramps are really so common, but one thing that happens is that with cramps, normally when a woman has just got pregnant, when she has been confirmed that she is pregnant, the increasing size of the uterus, the uterine muscles or the muscles of your womb in preparation of receiving this fertilized egg, or the fertilized egg growing after attaching itself on the uterine womb or on your womb, normally the changes that are happening tend to bring about the crampy, or they tend to bring about the cramp pains. So it's very important when you are getting those cramps to go have the urine pregnancy test. Remember, it could be a pregnancy, or the cramps could be a sign of something else, like maybe premenstrual. It could be a premenstrual symptom, or a sign that you could be going into your you could be going into your periods, and maybe you may not be pregnant, but cramps are among the first early pregnancy signs. Acne or skin breakouts. Increase in a woman's hormones, pregnancy hormones after getting pregnant, tends to bring about acne and skin breakouts. Specifically, this is purely hormonal and you do not need to worry about it. If the skin breakouts are happening around your areola or around your face, consider using some safe moisturizers depending on where you live. You can always talk to your pharmacist or you can talk to your doctor, who will recommend moisturizers that are not dangerous or that will not bleach you. So talk to your doctor or your fertility expert to advise you on which moisturizers are the best to prevent the skin breakouts. But acne or skin breakouts are among the early signs of pregnancy. A missed period. Now, this is among the best and among the most recommended early pregnancy sign. When you are supposed to see your periods, like maybe today, but you miss seeing your periods and you go on, you take 1 week, you take 2 weeks, this is the best time to do the urine pregnancy test. Please do not rush to do the urine pregnancy test simply after you've missed your period. You may get a test that may confuse you. So a missed period is the most significant sign of early pregnancy, and remember to have the pregnancy test done 2 weeks after you've missed your periods. The main reason is that the pregnancy hormone, known as the HCG hormone, is always highest 1 week or 2 weeks after getting pregnant. Thanks a lot for passing by, for watching and learning from today's lesson. We were talking about early pregnancy signs, and this is a summary of the signs of early pregnancy. The first is tender or swollen breasts. Next, itchy nipples in early pregnancy, spotting or implantation bleeding, high basal body temperature, a feeling of tiredness or fatigue, headaches, you may get frequent headaches, nausea, feel like vomiting all the time, frequent urination, backache, the back pains a lot, food cravings, you crave for particular types of foods, food aversions, specifically this is like a heightened sense of smell to particular foods, mood swings. Mood swings specifically, we are talking about you may feel low, you may feel high, you are happy today, tomorrow you're not happy. So that could be a sign of, it could be an early sign of pregnancy, and it's due to hormones. Cramps or pains, abdominal pains. Remember we talked about cramps, we said it is due to the increasing size of your womb. acne or skin breakouts is also purely hormonal, and we've recommended that you could talk to your gynecologist or your doctor, who will recommend some lotions. And lastly, we've talked about a missed period. A missed period meaning that fertilization and pregnancy has taken place, so ideally there will be no shedding of the endometrial lining, because we know that shedding of the endometrial lining is basically periods, or it is menses. So when you miss your periods, it is the biggest sign to confirm that you could be pregnant. And to go ahead and confirm, you need to do the 3 recommended tests. The first test is the urine pregnancy test, which has to be done early in the morning when the levels of the HCG hormone are high. You could also do the blood pregnancy test, which looks for the HCG or the pregnancy hormone in your blood. And lastly, you could do what we call an obstetric, or when is the best time to get pregnant? When is the best time to get pregnant? Ovulation date. In this video today, we are going to talk about the best time to get pregnant. If you are a woman out there and you are looking at getting pregnant faster, then this video is for you. You are going to learn about the ovulation date, and by the end of this video, you will know when the best time is to get pregnant. Gerald Massa, the Health Educator, is the name of the channel, and we are going to talk about when is the best time to get pregnant. So the first thing we need to point out is that to get pregnant faster, you need to understand your ovulation calendar. You need to understand your ovulation date. We are talking about when is the best time to get pregnant. After this short message, please don't leave. Keep watching. We are going to talk about when is the best time to get pregnant. Thank you, my friend, for staying around. We are talking about when is the best time to get pregnant. Gerald Massa, the Health Educator, is the name of this channel. And on this channel, we talk about the ovulation calendar. We talk about pregnancy tips. We talk about women health, including ultrasound scans. If you are new here, I welcome you, my friend, and remember to subscribe. Click the subscribe button, also hit the bell for notifications so that you do not miss any videos we put out. We release videos every day at exactly 17 hours. So when we talk about the best time to get pregnant, we need to understand first of all how your cycle is. The normal menstrual cycle ranges from 21 days to 35 days. So if you have a 28-day cycle and you see your periods on the first day, the second, and then on the third, this is basically an example. You could be a woman who goes into your periods for maybe 6 days, but we are taking a 28-day cycle. When you see your periods on this date and then the second and the third, then to get your ovulation date, the best thing you need to do is you begin counting from the first day, then count up to the 14th day. The 14th day highlighted here is when you are supposed to be ovulating. And when we talk about ovulation, simply we are talking about that period when an egg is being released. The time when an egg is being released from your follicles, from your ovaries, that is what we call the ovulation date. And specifically, you just have to count the days you are in your periods. Do not mind about the rest of the days. Just count beginning from the first day and then count 14 days. And when you count 14 days, it means you are supposed to be ovulating around this period. When is the best time to get pregnant? The best time to get pregnant is that period when you are ovulating. Do not leave. We are going to talk about this in detail. The most important thing we need to note is that when ovulation happens, there are many changes which will take place in your body. The first change is that there's going to be an increase of hormones. The hormones we are talking about here include the follicle stimulating hormone and then the luteinizing hormone. Although there are other hormones like progesterone and then estrogen or estradiol, but the most important hormones we are talking about here include follicle stimulating hormone and then luteinizing hormone. When the time for ovulation reaches, what is going to happen is that these hormones are going to be released from the anterior pituitary gland, and then when they are released, they will go to your ovaries. Your ovaries are also known as gonads, and then these two hormones are going to stimulate your ovaries to release the egg. They are going to stimulate the ovaries to release the egg, and when the egg has been released, it's going to go to that particular part of your fallopian tube known as the fimbria, and then it will hang around there for only 12 to 24 hours. When the mature egg has been released, and then it is in the fallopian tubes and it has not yet been fertilized, after 12 to 24 hours, exactly after 24 hours when fertilization has not taken place, what is going to happen is that it is going to disintegrate, it's going to disappear. So when is the best time to get pregnant? The best time to get pregnant is when you are ovulating. And then also we should take this very important point that if at all you would like to increase your chances of getting pregnant, there are 3 key things you need to put in mind. The first is that you should be having a healthy egg. Your ovaries should be functioning very well. When we talk about the ovaries functioning very well, they should be able to put you through ovulation. You should be ovulating very well. Of course, to ovulate, it means your ovaries are working very well. The other thing is that there should be a healthy sperm. Healthy sperm means the sperms or the sperms from your husband should be healthy in such a way that the quality and the quantity should be within the normal ranges. If your husband has poor quality sperms, or if your husband has issues with his sperm analysis, then you realize that even though you ovulate, getting pregnant may become difficult. So if you are a couple and you have tried to get pregnant, but really things are not working out for you, or you have tried but you've done all the tests, or you've taken all the medications and maybe you've not done the tests, then this video is for you. The most important things you need to take from this video, from this lesson for today, is that for you to get pregnant much more faster, number 1, you should be having what we call healthy sperm. That is, the husband should be having a healthy sperm. To know whether your husband, or if you are a husband to your wife, to know if you have healthy sperm, the most important test you need to do is what we call the semen analysis test, whereby a sample of your semen will be taken. Your laboratory technician will tell you on how to collect the sample. So after collecting the sample will be analyzed in the lab, and then the spermatozoa or your sperms will be analyzed on motility, that is how they move, and then the structure, how they appear. If at all they are sperms but they are lacking, probably maybe they are lacking some parts like the tails, they are lacking some key parts, then you realize that if the sperms are missing the tails, then motility or movement will be impaired. They will move very slowly. The other thing is that the sperm is made up of 3 key things. It is made up of the head, and then the neck, and then also the tail. So if at all on the head there is low acrosome. Acrosome is that chemical which is actually on the head. It is the chemical which is actually released when the sperm meets the egg, and then it basically wants to penetrate. The acrosome is like it's like the gatekeeper. It opens the gate. It's the one which knocks the shell of the egg so that the real nucleus penetrates and then does the fertilization. So if your sperms are lacking the acrosome, then you realize that still they may not be able to even knock through the egg. They may hang around the egg on top until they die off due to the environment of the surrounding fallopian tubes. So in this video we are talking about when is the best time to get pregnant and the ovulation date. We've talked about the ovulation date and we have answered that this is the 14th day from the first day you saw your periods. If you are new here, I welcome you, my friend, and please remember to subscribe for new videos videos about women health, new videos about reproductive health. I welcome you, my friend. I'm so happy to have you here, and remember to come back tomorrow at exactly 17 hours. We release new videos every day about women health. If you have that question, that burning question, please go straight away in the comments and then post your question there, or submit your question. As soon as you submit it and as soon as I see it, I will answer. You can check through the comments. You can see how I have been answering our friends' questions, all the questions that have been asked. At least I'll try my level best to answer all your questions. Remember, getting pregnant is very, very easy. The most important thing is that you need to understand how your body is. If there's a deficiency or if there's something that is not right, you need to correct it. And then also you need to put God first, because we can give you all the education, we can advise you, we can tell you what we learned in school, but the most important thing is you as an individual, you as a couple, you need to put God first, because God can move mountains in our lives. Next point we are talking about is when is the best time to get pregnant, and we are saying that for you to get pregnant, the best time is on the ovulation date, and the ovulation date is the 14th day. It's the 14th day, actually after from the first day you saw your periods. We have talked about the hormones that are really responsible, or the hormones which play a big part in ovulation. And these two hormones we have said include the follicle stimulating hormone and then the luteinizing hormone. We said that the follicle stimulating hormone is released by the anterior pituitary gland. This is also stimulated by the hypothalamus, which is just above it. The hypothalamus releases a hormone known as the gonadotropin releasing hormone, and then this gonadotropin releasing hormone goes to the anterior, or it signals to the anterior pituitary gland to release the gonadotropins. These are the follicle stimulating hormone. You'll see your doctor will write for you on a request that you go and test for FSH and LH. Normally when your doctor writes this, it means they want to assess the levels of these two hormones we are talking about here. So when the anterior pituitary gland releases the FSH and LH, these two hormones go and they stimulate your ovaries. Now the issue is, if you have tried to get pregnant, you are ovulating, you have all the normal signs, your periods are regular, but still getting pregnant is really difficult, then it means there could be a problem. It means your anterior pituitary gland could be stimulating, it could actually be producing the two hormones, that is FSH and LH, but when they reach your ovaries, they are not doing their function. Maybe on the ovaries, there are issues on the ovaries. There could be issues like maybe a presence of polycystic ovarian syndrome, also abbreviated as PCOS or PCOD, polycystic ovarian disease or polycystic ovarian syndrome. Polycystic ovarian syndrome is a condition where the ovary is filled with many cysts. Cysts are small growths or masses on your ovaries, and we call it polycystic ovarian syndrome because it is a disorder which actually affects the ovaries. It affects the normal functioning of the ovaries. How can you tell that you are ovulating? You can tell that you are ovulating by using the ovulation predictor kits, but also you could look at some key signs. For example, the discharge from your private parts, the discharge from your vagina is going to be sticky, it's going to be a lot, it's going to be increased, and then you'll feel the you'll feel the top of your cervix, it will go backwards, inwards, and then it will tend to open in preparation for creating space, for creating a way for the sperms to go through. And then of course you'll be having some body changes. For example, your breasts will become tender or they will be painful, and then also you'll feel like you'll be having what we call increased libido, or you'll be having increased sexual urge to be with your partner. These are normal changes which basically happen to signal to you that you are in your ovulation days. So if you are a woman and you have tried to get pregnant and you are ovulating, but pregnancy is not happening, then it means you need to have yourself checked out. You need to be assessed for some key things. The first test you need to do is what we call the pelvic ultrasound scan. We call it the pelvic ultrasound scan because it is an ultrasound scan, or it is a check of your pelvic region, checking all the pelvic regions. And when we talk about the pelvic regions, we are talking about the 2 ovaries, assuming that you have the 2 ovaries. But even if you have 1 ovary, but as long as it is ovulating and your fallopian tubes are patent or they are open, they are not blocked, you can still get pregnant. So we say that for you to get pregnant very easily, you should be having the 2 ovaries, or you should be having an ovary with an open fallopian tube, which is working very well. The next thing is that your ovaries should be normal. They should not be having issues like polycystic ovarian syndrome. But even if you have polycystic ovarian syndrome, still you can get pregnant. The most important thing is you need to master, or you need to look at your menstrual cycle and see how it has been moving, and then identify that period, that time when it is regular, and then also make sure that you consult your gynecologist so that they can guide you on which drugs they can put you on so that you ovulate well, and then you can get pregnant very easily. If you have polycystic ovarian syndrome, do not sit at home. Talk to your gynecologist. They will put you on some medications, and then they will advise you on how you can get pregnant faster. I have videos on this channel about how to get pregnant faster with polycystic ovarian syndrome. Please, after this video, you can go and watch that video. Still, it's among these videos on this channel. I welcome you, my friend. So we are talking about how you can tell that you are actually ovulating. We say that you can use the ovulation predictor kits. You can also look at your basal body temperature or basal body temperature. This is the temperature of your body, but normally this method, it involves charting for several days. You chart your body temperature at a specific time every day, and then you try to monitor. Normally during the time of ovulation, you are going to see a slight peak. There's going to be a slight increase, and then that slight increase normally is a signal that you have ovulated. So if you are looking at getting pregnant, it's not best to use the basal body temperature, though it can signal that you have ovulated. We are saying that it is not the best way to tell what to monitor to use to get pregnant, because by the time your body temperature rises, you would have already ovulated. And remember, when a mature egg, also known as a Graafian follicle, when it is released on the 14th day, it lasts for only 12 to 24 hours. So if at all it has been released for 12 to 24 hours, and then you actually maybe you realize that the temperature is rising and the egg was released like maybe yesterday, then the chances of getting pregnant will be decreased. The chances of getting pregnant are increased when you be with your partner, or when you have sex with your partner, with your husband 2 to 3 days before ovulation. The main reason is that sperm survives for 4 to 5 days, assuming that your husband has sperm of good quality and quantity. This can be identified in a good lab, a good laboratory. You need to go with your husband, or he can go there and then he gets this sorted out. And then when the results come out that he could be having issues with his sperm count, then still treatment can be given. These treatments are available. Your doctor can recommend you the best treatments, and then also the best diet for increasing sperms can also be recommended. I have videos talking about this. Please go and watch those videos in the playlist. Yes, they are talking about how to increase sperm analysis or the sperm count. So we say that the best way to tell whether you are ovulating or when you are about to get pregnant is by using the ovulation predictor kits. The ovulation predictor kits, also abbreviated as the OPK kits, are available in all big pharmacies near you. They actually can also be ordered online. What is happening is that they look for the hormone known as luteinizing hormone and then estrogen. There are some new ones which look for the 2 hormones, though there are also other cheaper brands which look for only the luteinizing hormone, but it's best to get one which looks for the 2 hormones, because it can actually it can give us a clear picture that now this is the time of ovulation, and then you can be with your partner. And then also the other thing is that for you to realize that you are in your ovulation days, you need to really be ready. You should be able to manage issues that are happening. For example, if at all you'd like to increase your chances of getting pregnant faster and you are in a stressful situation, please, you should you should sort out the stressors, manage it, and then of course your chances of getting pregnant will be increased. So when is the best time to get pregnant? Ovulation date. We have talked about when is the best time to get pregnant. Gerald Massa, the Health Educator, is the name of the channel. I welcome you, my friend, to our channel. I'm really so happy to have you. Remember to subscribe, and then remember to talk to me. Remember to interact. I mean, talking, caring is sharing. It's really good that when you have this question that has been burning for a long time, that has been disturbing you for long about your health, please go down in the comments, ask me. You could also connect with me on my WhatsApp. My WhatsApp numbers are two. That is +256 701 797876 +256 70. How to calculate ovulation for a Saturday cycle. In this video today, you are going to learn how to calculate your ovulation if your cycle runs for Saturdays. Gerald Massa, the Health Educator, is the name of the channel. Remember to subscribe for new videos we put out every day. Without further ado, the ovulation cycle for a Saturday calculation specifically begins with us having this example. We are taking an example of the month of August, and assuming you started your periods on 3rd, and then you saw your periods on 4th, and then you saw your periods on 5th. Let's say assume 3 days in your periods. If we want to calculate your ovulation date, or the date when you are most likely to get pregnant, the day when you are releasing a mature egg, also known as a Graafian follicle, let's say we have to begin counting from the first day you saw your periods. If you saw your periods on 3rd, you saw your periods Sorry about that. If you saw your periods on 3rd and then 4th and 5th, we're just taking this as an example. It could be any other day. It could actually even be 2nd. So, assuming you see your periods on 3rd, 4th, and 5th, and you want to calculate your ovulation date, you simply get the first day you saw your periods, which is on 3rd, and then you count the 3 days you are going to be into your periods. But the counting has to begin from the first day when you saw your periods, and then you specifically count 14 days from the first day you saw your period. Remember, once again, we've said that you saw your periods on 3rd, you saw it on 4th, and then you saw it on 5th. So count 14 days beginning with the first day you saw your periods. So we shall say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So the 14th day, which is actually is going to be a Sunday on 6th, on 16th, the 14th day is your date of ovulation. Specifically, this is the day when your hormones, that is luteinizing hormone and estrogen, are at their maximum. When we look at the ovulation calendar, you notice that during the 16th day, your hormone, that is the luteinizing hormone and the estrogen hormone, are at their peak. This is the date you are ovulating, and this is the date you are most likely to get pregnant, assuming when you have a 30-day cycle, assuming you spent 3 days. But if you spent 4 months, if you spent 4 days, let's say you started your periods on 2nd, still the same method applies. You have to begin counting from the first day you saw your periods, and that is, let's take an example of second. You still say 1, 2, 3 those are the days you've spent in your periods. So to get your ovulation date, simply count 14 days, but strictly you have to begin from the first day you saw your periods. So we shall count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So your ovulation date, or your date of ovulation, is going to be 15th. The formula is that you have to begin counting from the first day when you've seen your periods, then count 14 days. It doesn't matter where the date is going to fall, but you just have to count 14 days. If you saw your periods on 9th, still you just have to count 14 days, and we shall say 1, 2, 3, and then of course those are the days you are in your menses. We go back to the first day you saw your periods, and we shall count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So still your date of ovulation is going to be on Saturday 22nd, assuming you started seeing your periods on 9th. Your date of ovulation is 22nd, which is actually on Saturday. So what we have to learn from today's lesson is that you simply have to begin counting from the first day when you see your periods, and then count 14 days. On the 14th day, there is an allowance of 3 days upwards, and then there's an allowance of 3 days backwards. In other words, if your ovulation date is 19th, taking this as an example, we give an allowance of 3 days back and then 3 days in front. The main reason for this is that the two hormones, luteinizing hormone and LH, when they rise over a period of time. They rise over a period of number of days. You can never tell, because when the egg is released, the female egg is released, it lasts for at least 12 to 24 hours, whereas a male sperm survives for at least up to 5 days. So to increase your chances of getting pregnant, if your ovulation date is on 19th, it's always advisable that you be with your partner, play sex around the 2 days prior to, 1 to 2 days prior to. If you're seeing your ovulation, if your ovulation predictor kits are telling you that yes, your LOH, or the luteinizing hormone levels, are high, the cervical mucus is thick and sticky, your basal body temperature has risen, all these are indicators of ovulation. So it's advisable that at least you be with your partner 1 day or 2 days prior to. You could actually be together for the whole of this week, for the whole of this period. The chances of getting pregnant are really increased. Gerald Massa, the Health Educator, is the name of the channel. Let me know if you have any questions. And as we are summarizing in today's video, we've talked about the calculation of ovulation date, or the calculation of the date of ovulation for a Saturday cycle. And we have said that if you started your periods on this date, and this date, you calculate your ovulation date by simply beginning from the first day you saw your periods, and then count 14 days. It doesn't matter where the 14th day is going to fall. It could actually be here. It could be, you count 14 days, and then on the 14th day, add 3 days in front, 3 days back. That is your fertile window, the days you are most likely to get pregnant. And then the 14th day specifically is when the egg is released. After how many days pregnancy can be confirmed by a urine test. After how many days pregnancy can be confirmed by a urine test? Gerald Massa, the Health Educator, is the name of the channel. I welcome you, my friend. If you are new here, remember to subscribe. On this channel, we talk about pregnancy tips, we talk about the ovulation calendar, and we do also give advice in regards to ultrasound scans. After how many days pregnancy can be confirmed with a urine pregnancy test? Gerald Massa, the Health Educator, and remember to subscribe for new videos we put out every day. In this video, we are going to talk about after how many days pregnancy can be confirmed with a urine pregnancy test. After how many days pregnancy can be confirmed by urine test. After this message, I'm coming back. Keep watching. Hello, welcome to our channel. I'm Gerald Massa, the Health Educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. Thanks, my friend. We shall continue with our topic for today. After how many days pregnancy can be confirmed by urine test? We shall begin by defining what a pregnancy test is. This is a test done specifically to look for the hormone which is responsible for pregnancy, the hormone that is produced when a woman gets pregnant or when conception takes place. So this hormone is known as the HCG hormone, also known as the human chorionic gonadotropin hormone. So gonadotropin hormone. So what happens is that when a pregnant woman does this test, or when fertilization has taken place, this hormone is going to be produced, and when it is produced, it can actually circulate in the body, and then it can be detected in urine. In very early pregnancy, in the early days when a woman has just got pregnant, the levels of this hormone are typically very low, and then later on as the pregnancy progresses, the levels of this hormone also keep increasing. The question is, after how many days pregnancy can be confirmed by a urine test? The most important thing we need to get here is that the release of this hormone happens gradually. It happens slowly. So if at all a woman goes ahead and she tests for pregnancy, there are two things that are going to happen. There could be errors in the first place, or there could be results being given immediately. The errors are specifically due to two things. The first thing is that it could be due to the timing, and then it could also be due to the interpretation of the results. After doing a pregnancy test, it is very important to consider timing. Timing is very, very important, because if you do the pregnancy test, maybe using whichever method is available, and then you do the test and the results show that specifically you are positive, or the pregnancy test is positive, this actually means that the test has detected, or the test has detected the HCG hormone, and normally this is 80 to 90% correct. If at all the test shows you that you are negative or you are not pregnant, and yet inside you are feeling you're feeling changes in your body, and the test has shown you that you are not pregnant, it's always advisable to wait at least for the next 1 to 2 weeks, because probably you might have tested too early before the hormone was released. That is due to timing. The first error is due to timing. The next error could be due to interpretation. When a woman tests for pregnancy using the urine pregnancy test or the urine pregnancy test strips, what happens is that the interpretation of the results should take place within the recommended time by the manufacturer. The manufacturer of the pregnancy test strips specifically has instructions on top of the package. Make sure that you read the instructions very well, because there are some manufacturers who will put that the tests have to be interpreted within 1 minute, whereas there are some tests, or there are some manufacturers who will put and say that the results have to be interpreted within 2 minutes. So when you do the pregnancy test, make sure that you read the instructions, because when you do not read the instructions, you can end up getting results which are not correct, or we call them the false positive results or the false negative results. So the two commonest errors in pregnancy tests, or in the two common errors in pregnancy testing, are due to timing, that is one, and then the next one is due to interpretation. The timing should be according to the manufacturer. Normally the recommended time is within 1 to 2 minutes. If you take the pregnancy test maybe early in the morning, which is the best time, and then after doing the pregnancy test, you put the strip on the side, and then you go on and do your other work of the day, and then after 2 hours or after 6 hours, you remember that you did the pregnancy test, and then come back very fast and read the results. What is going to be happening is that you are most likely to see what we call false positive or false negative results. The main reason is that the HCG hormone specifically can be interpreted within the recommended time according to how the manufacturer instructed you to read the results. So what happens is that if at all you saw, if it was supposed to be a positive test, maybe the two lines have crossed, or the testing kit has shown you, because there are those which show they show the word pregnant or not pregnant. So probably the results showed at first within the 1 to 2 minutes, but because there was delay, the results actually went back to negative. So this normally happens due to evaporation. Urine or tends to evaporate from the testing strip, and then of course the changes or the results will become false. The main point we need to take from here is that when you have done the pregnancy test, make sure that you read the results within 1 to 2 minutes. Failure to read the results within 1 to 2 minutes, it means the results are no longer accurate. They may give results which are wrong, and the best advice is you should at least consider repeating the test again with another testing strip or with another testing kit which is at least brand new. The next is interpretation. Make sure that you interpret the results correctly. Remember, we've said that it should be within 1 to 2 minutes. But also, if you get a negative test, you've done the pregnancy test but the results come back and then it's a negative test, the best advice is that you should at least consider repeating this test after 2 weeks later on. Or you could actually also contact your doctor, who will repeat the pregnancy test using other methods. Your doctor might actually request for a blood HCG pregnancy test, which looks for the HCG hormone but in your blood. Or your doctor could also order what we call a pelvic ultrasound scan, which can actually show changes on your uterine lining, also known as the endometrium. If at all it becomes thickened and then it increases in its size, the inside of your womb, if it is thickened and it is actually hyperechoic. Hyperechoic is a term normally used by doctors of ultrasound. Your doctor will give a result that yes, there are changes of implantation or there are changes of pregnancy happening in your womb. The question is, after how many days pregnancy can be confirmed by a urine test? After how many days pregnancy can be confirmed by a urine test? So to answer this question, having talked about the pregnancy tests, we need to understand that after ovulation has taken place, and maybe you did the timing. We've been talking about ovulation. You can, if you missed our topics about ovulation, there are lots of videos on our channel. Go to our video library and then look at the videos talking about ovulation. Ovulation is the release of the egg on the 14th day. Please, if you missed our videos, if you're new here, remember to subscribe and go to our video library and then look at our videos. We've been talking about ovulation. So, to answer this question, after how many days pregnancy can be confirmed by a urine test, simply you need to take this point home and say that if at all ovulation has happened, and maybe you were calculating your ovulation days very well, and then you had sex with your partner on the ovulation day, or you actually after ovulation or after you've been with your partner, there are some tests which are so sensitive that they can detect even the slightest amount of HCG in your urine. But the best amount of days, the best number of days to test for pregnancy is at least 12 to 14 days after conception, or 12 to 14 days after you have missed your periods. If you miss your periods, at least wait for 12 to 14 days and then do the test. You could do the test earlier on, but remember there are chances that you could end up with results which are not so conclusive. For example, you could end up with a negative test, but yet you are actually pregnant, but maybe you tested too early. So what you need to take home from this video is that always the best time to test for pregnancy is when you have missed your period. Can you get pregnant on the first day of your periods? Can you get pregnant on the first day of your periods? Gerald Massa, the Health Educator, is the name of the channel, and today we are answering the question, is it possible for you to get pregnant on the first day when you see your periods? We are answering the question, is it possible for you to get pregnant? Can you get pregnant on the first day of your periods? We are answering this question after this message. Keep watching. Thanks a lot, my friend, for watching our video. Today we are answering the question, can you get pregnant after, on the first day when you see your periods? So we shall remind ourselves that when we look at this is the reproductive system of a woman, we have follicles or egg cells in here. These are the ones which are released, and then on fertilization they form a zygote. They form that cell which is called the blastocyst, which comes and attaches itself on your uterine wall, on your uterine lining. We call this implantation, and then growth takes place, becoming a baby. So to answer the question, can you get pregnant on the first day of your period, we shall first of all take this as an example. If you see your periods on any particular date, for example, if you see your periods on 9 being your first day, we know that you have to count 14 days, and on the 14th day, that is when you are most likely to get pregnant. So to answer the question, can you get pregnant on the first day of your period? It's not really possible for you to get pregnant on the first day of your period. The main reason is that on the 14th day, that is when you are ovulating. That is when the chances of getting pregnant are very high. So on the first day, your periods are coming out, but it is really not possible to get pregnant on the first day, because the first week, the first day followed by the second day, the third day, and the fourth day, if you spend 4 days in your periods, normally there's shedding of blood, there's basically menstruation happening. So it's not possible for you to be pregnant, because that is not the period, that is not the time when you are ovulating. The only time you can get pregnant is when you are ovulating, and normally that is on the 14th day. And specifically, during the process of ovulation, there is a release of several hormones, but we shall talk about two main hormones here. The first hormone is what we call estrogen, and then the next hormone is progesterone. And also there's another hormone which is very important, and it is known as the luteinizing hormone. So the only way to confirm whether you are able to get pregnant is by using what we call the ovulation predictor kits. These can easily be got in any nearby pharmacy near you, and these can easily be used. They look like pregnancy test strips, but they can tell whether you are in your ovulation or whether you are about to get pregnant. So to maximize the chances of getting pregnant, if we take an example of 24th, if this is the date you are ovulating, we always advise that you be with your partner at least at least 1 day before your date of ovulation. The main reason is that the hormone known as the luteinizing hormone is actually very high when you are about to go into ovulation date. If you are about to enter your date of ovulation, then normally we advise that you be with your partner. So the only time you can get pregnant is during ovulation, 3 days before, 3 days after. That period you can easily get pregnant. If at all you are on your first, can you have fertile cervical mucus but not ovulate? Can you have fertile cervical mucus but not ovulate? In this video today, we are going to answer the question, can you have fertile cervical mucus but at the same time not ovulate? Gerald Massa, the Health Educator, is the name of the channel. I'm really so happy to talk to you, my friend. Thank you for subscribing. You'll be able to get new videos I put out every day about women's health, about fertility, infertility, pregnancy related topics. On this channel, Gerald Massa will talk about women's health. So in today's lesson, can you have fertile cervical mucus but not ovulate? We are going to begin by defining what we mean by the term ovulation. Specifically, ovulation is the release of an egg which is mature, and this happens on the 14th day. If we take an example of this calendar, assuming we are using basically an example, if you saw your periods on day 3 and then on day 4 and then on day 5, what happens is that to calculate your ovulation date, the day you are ovulating, you specifically begin counting from day 3, and you begin counting, we take the first day you saw your periods to be our day 1, and then we shall say 1, 2, 3, and then we shall proceed and count up to 14. So this is 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So if you saw your periods on day or on 3rd, that being our day 1, your ovulation date is 16th. So ovulation means chances of getting pregnant are really increased. The chances of getting pregnant, or the day you are most likely to get pregnant, is what we call the ovulation day, and it's basically the 14th day from the first day you saw your period. We are using this as our background study to answer our question, can you have fertile cervical mucus but not ovulate? Having understood ovulation, that this is the release of an egg which normally happens on the 14th day, an egg begins an egg is released when it actually is really small on the 14th day, and then it goes on, actually an egg begins growing during the follicular phase, and then it begins growing, and then it goes on until it becomes a mature egg. So on the 14th day, it is actually called the Graafian follicle. So when this egg has been released, it normally lasts for only 12 to 24 hours. When an egg is released during ovulation, it lasts for only 12 to 24 hours. So to answer the question, can you have fertile cervical mucus but not ovulate. It is very possible for you to have fertile cervical mucus but at the same time not ovulate. What we need to ask ourselves is this: what could be causing this fertile cervical mucus to be released but at the same time not ovulate? There are many causes for this, but we shall explain the most important causes of you seeing your fertile cervical mucus, which is actually the color of watery raw egg white. So when you begin seeing a discharge which is watery and then it is having raw egg white, normally that is a sign that you are actually ovulating or you are about to ovulate. But there are some women who will see the same discharge, have fertile cervical mucus, but at the same time not ovulate. Remember, we said that the whole process of ovulation is controlled by two hormones. These are the follicle-stimulating hormone and then the luteinizing hormone. So if at all these hormones are not being produced in sufficient quantities, there's going to be, your body will begin making the changes, your body will begin making the changes of ovulation, but the whole process of ovulation will not happen. It will not happen. So you actually will be able to get a rise in the temperature. You will actually also have that cervical fluid which will increase, but ovulation may not take place. This is also known as anovulation, failure of ovulation to happen. Normally it is due to the body having issues. For example, if a woman has a disease of the ovaries known as polycystic ovarian syndrome, abbreviated as PCOS, it actually can make you to feel as if you are ovulating. You will get the signs of ovulation. The discharge, the watery discharge will come out, but ovulation may not happen. As a result, getting pregnant becomes difficult. So if you have tried to get pregnant, you calculate your days very well, you ovulate, but at the same time you do not get pregnant, it is high time you may actually need to go and talk to your doctor or your reproductive endocrinologist or fertility expert, who will request some tests to be done on you. And the commonest tests that are done include the pregnancy or the pelvic ultrasound scan, and then also the fertility hormonal screen test, whereby hormones are checked to really assess their levels in your body. The hormones that are normally tested are progesterone. Progesterone normally increases after ovulation. Progesterone increases immediately after our ovulation, and then this hormone is supposed to increase because it is a pregnancy-friendly hormone. Progesterone rises because it is preparing the body, it is preparing your womb for the fertilization or the fertilized egg that happened, and the fertilized egg that is coming in from the fallopian tubes. So if you see your fertile cervical mucus, we know that you are ovulating. But if we go ahead and then test for progesterone, and then the levels of progesterone are very low, and yet we know that progesterone is supposed to be high, indicating that ovulation has happened, the next step is pregnancy. So if we test for your ovulation, we test for your progesterone levels, and immediately after you've ovulated and the levels are low, then it means you could be having a problem, whereby treatment can be given. The other hormone that is tested is the follicle-stimulating hormone. Sorry about that. The other hormone that is tested is the luteinizing hormone and the estrogen hormone. These are also very important in determining ovulation because they tend to rise when you are about to go into ovulation. Luteinizing hormone and estrogen rise when you are about to go into ovulation, and then after ovulating or on the ovulation date, they peak, they rise so high, but immediately after they also tend to go down. So can you have fertile cervical mucus but not ovulate? The answer is yes. You can have fertile cervical mucus but not ovulate. It is also known as anovulation. The best advice is your doctor will order or will request a pelvic ultrasound scan, and then also your doctor will request fertility hormonal screen tests or a test of your hormones to determine the cause. The good news is that if at all you go and get these tests done, if you do the pelvic ultrasound scan and then you also have your hormones checked, normally the cause can be identified. If it is found out that you are having polycystic ovarian syndrome, still treatment can be given and you can go on and get pregnant and have successful pregnancies. If you sit back and you say you are not going to get assistance, maybe you put the blame on yourself, or you put the blame on your partner, normally this may not be good, because there's always a timeline, and when a woman makes it to 40-45 years, normally you may never know, maybe if at all you had got assistance, probably you might have maybe gone on and got pregnant. So seeking for assistance, seeking for advice is very important. If at all you are trying to get pregnant, it's always very good that you talk to your doctors, you talk to your experts. They can always advise you accordingly. In today's video, we have talked about, can you have fertile cervical mucus but not ovulate? And we have answered the question that yes, it is very possible for you to have fertile cervical mucus but not ovulate. Gerald Massa, the Health Educator, is the name of the channel. Remember to hit the subscribe button so that you can be able to watch new videos, learn new things about fertility, the tips to get pregnant faster, the 35-day cycle, the tips to get pregnant faster, the 35-day cycle. In this video today, we are going to learn about how you can get pregnant faster when you have a 35-day cycle, your ovulation day for a 35-day cycle. Gerald Massa, the Health Educator, is the name of the channel. I welcome you, my friend, on today's lesson. For today's lesson, I welcome you. If you are a woman out there and you have tried to get pregnant faster and things have not really been so easy, then in this video you are going to learn how you can get pregnant faster when you have a 35-day cycle. The most important thing we need to understand is that getting pregnant begins with you understanding how your cycle is, assuming all other factors are kept constant, assuming you have a regular cycle, assuming you don't have any diseases of the reproductive system, for example, polycystic ovarian syndrome, assuming you have hormonal balancing, your hormones are balancing, then this lesson is for you. But even if you have issues with hormones, if you have issues with polycystic ovarian syndrome, still I have made videos on this channel. You can go check our videos on how you can get pregnant faster even if you have polycystic ovarian syndrome. The signs and symptoms of a twin pregnancy. Twin baby pregnancy symptoms. Conceiving twins is our lesson for today. We are going to look at what are the signs and symptoms that you are pregnant with twins. Gerald Massa, the Health Educator, is the name of the channel. We are talking about the signs and symptoms of a twin pregnancy. Are you pregnant? Do you suspect that you could be carrying twins? Then this video is for you. Keep watching. After this short message, I'm coming back and we are going to talk about the signs and symptoms of a twin pregnancy. Thank you. Thanks a lot, my friend, for staying around, for watching our video for today. And by the end of this video, you are going to be knowing all the signs and symptoms of a twin pregnancy. Gerald Massa, the Health Educator, is the name of the channel, and I welcome you, my friend. If you are new here, remember to hit the subscribe button. Click the subscribe button so that you get new videos we put out every day. On this channel, we talk about women's health, we talk about fertility, ovulation calculator. We do also give pregnancy tips. Subscribe so that you get new videos every day at exactly 17 hours East African time. So without further ado, we should talk about this very important point, that it's only an ultrasound scan that can confirm that you are carrying twins. It is the best way to confirm that you could be carrying twins, but still there are other signs and symptoms which are very important, and they can also help us tell whether you are pregnant with twins or you are carrying a single baby. So what is happening is that some mothers who are pregnant with twins say that they suspect they could be carrying twins, but still they may be having some signs and symptoms. But the truth is that while there are several signs and symptoms of a twin pregnancy, there's also tremendous overlap with the signs and symptoms of a singleton pregnancy. A singleton pregnancy is a type of pregnancy where you are having a single baby or a single fetus. It is impossible to definitely know whether you are carrying twins or multiple babies by simply gauging how you feel or going off of what a home pregnancy test shows. So you cannot do the home pregnancy test with the urine HCG test and then say that you are carrying twins. No, you are going to get results. Still, you will get the positive results, but this is not a conclusive way of telling that you could be carrying a twin pregnancy. So we shall go to the first sign and symptom of a twin pregnancy, and this is morning sickness. There's a saying about twins that twice is really much. Twice is really much. So what is happening is that if at all you are carrying more than one baby, then if at all at first you are pregnant with one baby, you will get morning sickness. But imagine if you are carrying two babies. If you are carrying two babies or even 3 babies, then the morning sickness is going to be more. So the first sign that you could be carrying a twin pregnancy is that your morning sickness will be increased. The morning sickness will be a lot. So if you are a woman out there and you are pregnant and your morning sickness, the morning sickness is much as they call it morning sickness, but it is basically that feeling of weakness, that feeling of you're tired, and it can actually come throughout the day. Though they call it morning sickness, but it can actually happen throughout the whole day. But in twin pregnancies, it is going to be much. It is going to be increased. So the first sign that you could be carrying twins is that your morning sickness will be doubled. Next sign of carrying twins, next sign that you could be carrying twins is elevated beta HCG levels. Your beta HCG levels will be elevated, and remember, when we talk about HCG, basically we are talking about the human chorionic gonadotropin hormone. This is the hormone that is released when a woman gets pregnant. It is released by the placenta. It is also released by the corpus luteum, in early pregnancies when fertilization has just taken place. But when the fetus has implanted, or when the baby has implanted onto your womb, then the placenta begins producing the HCG, plus other parts of the body also they could also produce the HCG. So the levels of the HCG are going to be doubled. You cannot conclusively distinguish a single pregnancy from twins on a urine pregnancy test, but still when you do the blood HCG test, the levels are going to be increased. They are going to be doubled. Next pregnancy symptom is that there's going to be severe fatigue. We talked about the morning sickness being doubled. So the next sign that you could be carrying a twin pregnancy is that you are going to be having severe fatigue. Extreme fatigue is the most commonly reported complaint during pregnancy with multiples. So if you are a pregnant mother and you are experiencing extreme fatigue, then there are high chances that you could be actually carrying twins. In some cases, the fatigue can be attributed to other factors, and these include stress, work, and then also poor nutrition, not feeding well, and then having other children you are taking care of. Then still, this means that you could be overworked. But if at all you are pregnant and you are having extreme fatigue, then it is basically very important that you go ahead and talk to your doctor, who will request for some tests to be done, some tests to be performed on you. Another point we need to take is that fatigue is rather a subjective symptom and has many other causes. If at all you are pregnant and you are fatigued, you feel tired a lot, please consider talking to your doctor, who will order some tests. These tests may include a CBC or a complete blood count. Here, a whole check will be done on your blood cells, whereby your doctor will look at your white blood cells, the white blood cell count, the red blood cell count, and then also your platelets. Any abnormalities, any deviations from the normal, then this could actually mean that you could be having another cause or something else causing the fatigue. For example, low hemoglobin levels or having low HB levels. Still, this can be managed if at all it has been identified. If you are pregnant and you are having extreme fatigue, please talk to your doctor so that some tests may be done. If you are in the tropics, like in Africa, this could be, the extreme fatigue could be due to malaria. It could also be due to infection. Next pregnancy symptom to confirm that you could be carrying twins is abnormal AFP test results. Abnormal AFP test results. When we talk about the AFP, we are talking about the alpha fetoprotein. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. It's also known as maternal serum screening or multiple marker screening. It is used to identify increased risks of certain birth defects. So if you are pregnant and your levels of the AFP, that is the alpha fetoprotein, is really high, then you could be actually carrying twins. But remember, the alpha fetoprotein test is used to detect increased chances of getting birth defects. So a twin pregnancy can produce an unusually high or positive result. Still, when you do this alpha fetoprotein test, which is used to detect birth defects, but if you do this test in your hospital or in a nearby hospital or health facility and the results turn out to be positive, please consider talking to your doctor. This could be a sign, this could be a symptom of a twin pregnancy. If you do this and then you go ahead and do the obstetric ultrasound scan or the pelvic ultrasound scan, and it turns out and it shows that you are pregnant with one baby, but you have an abnormally high alpha fetal protein test, then please you need to repeat the ultrasound scan, and your sonographer or your doctor doing the scan should really pay more close attention, because the baby could be having some birth defects. For example, birth defects including cardiac issues or defects of the nervous system, like for example the spina bifida. So whenever you are pregnant and you have an abnormally high alpha fetal protein test, then it is very important that you go ahead and talk to your doctor. Next pregnancy symptom to really tell us that you could be pregnant with twins. Next symptom is that you'll be measuring large. Throughout your pregnancy, your doctor or midwife will measure the height of your uterine fundus, measuring from the top of your pubic bone to the top of the uterus. To measure the uterine fundus, measurements are done from the top of your pubic bone. The pubic bone is specifically that bone in your pelvis up to the top of your uterus, that is around your umbilicus or your umbilical cord. This is a method by which estimation of the gestational age is done, but still, if at all the results come out and they are not conclusive, then your doctor or your midwife will request for an ultrasound scan. A twin or multiple pregnancy may cause the mother's uterus to expand beyond the range of a single pregnancy. However, other factors may also increase the measurements. This measurement is more difficult in earlier pregnancies or when the pregnancy is in the early stages, whereby your midwife will basically record that the pregnancy is palatable or it is basically palpable. But later on, as the baby is growing, this measurement is very, very key. It can actually give us a clue, because if at all the measurements for the expected age, if the baby is expected to be 20 weeks, but your measurements are way much more higher, then you could be actually carrying twins. You need to confirm with your doctor you could be carrying twins. Next pregnancy symptom to confirm that you could be carrying twins is fetal movements will be increased. Feeling a baby or babies move inside your womb is one of the most thrilling factors of pregnancy. This is also known as quickening, or the time at which you first feel your baby. This occurs between 18 up to 25 weeks. This is basically in the 3rd and the 4th trimester, but it can also, it actually begins in the 3rd and the 4th trimester. This is between 18 to 25 weeks, but is usually detected earlier on in subsequent pregnancies as early as 16 weeks. When women feel movement in early pregnancy, this is normally, actually it is a sign to show that the baby is well, to show that the baby is okay. But when the movements increase, then it could actually be an indication that you could be pregnant with twins. Next pregnancy symptom to confirm that you could be carrying twins is there's weight gain. While mothers of twins only gain about 10 pounds more than singleton mothers, the amount of weight a woman gains often depends on her height, the body type, and how much she weighed before the pregnancy. So much of the increase in weight gain occurs later on in pregnancy, often after an ultrasound has already confirmed or excluded a diagnosis of twins or multiple babies. So weight gain is one of the signs and symptoms that you could be carrying a twin pregnancy. In twin pregnancies, your weight will actually double. Gut feelings and hunches is our next pregnancy symptom to really tell us that you could be carrying a twin pregnancy, while the other types in this list refer to some kind of visible evidence. Exaggerated symptoms, abnormal test results, increased morning sickness, and more can also be used to really say that you could be carrying a twin pregnancy. Lastly, the most important point we are taking home from this video is that you should do what we call ultrasound scanning. Seeing is believing. The only way to confirm that you could be or you are carrying twins is by doing an ultrasound scan. Specifically, you do what we call a pelvic or obstetric ultrasound scanning, though in most cases your doctor will opt for an obstetric ultrasound scanning because it is much more precise. It's much more on point. It is very unlikely that an ultrasound scan would miss an additional baby. At least an ultrasound scan can show that yes, there's a second baby somewhere. However, there have been cases of hidden twins. In particular, a hidden twin is more likely on an early ultrasound scan than when the baby is actually much more grown. Thanks a lot, my friend, for watching today's lesson. By the end of this lesson, I hope you've learned the signs and symptoms that you could be carrying a twin pregnancy. And yes, if you have any questions, ask me all your questions down below in the comments. I will be very happy to answer all your questions. Remember, the signs and symptoms that you could be carrying a twin pregnancy is that there's increased fatigue, there's increased morning sickness, there's elevated beta. How to track your ovulation with irregular periods. In this video today, you are going to learn how to track your ovulation with irregular periods. Do you have irregular periods? Would you like to know the days when you are most likely to be ovulating? In this video, we are going to learn about ovulation tracking, how you can track, how you can tell that yes, this is the time to get pregnant, even if you have irregular periods. After this message. The first method of tracking your ovulation, even if you have irregular periods, is by what we call charting your cycle. When we talk about charting your cycle, specifically we are talking about understanding how your cycle moves. Let's give an example. If at all you see your periods on, let's say on Tuesday, this column is for Tuesday, and then you see your periods on Wednesday, you see them on Thursday. When you want to chart your cycle, specifically you have to understand that the first day when you saw your periods, that was on Tuesday, you begin counting from the first day up to the 14th day. So we can say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So specifically on the 14th day, that is when you are most likely to be ovulating. Actually, that is when you are ovulating. And on the 14th day, we add 3 days in front, and then we subtract 3 days behind. Let's say if at all this is the 14th day, all you have to do is you add 3 days in front, and then you subtract 3 days. These 3 plus 3 and then plus the ovulatory day, that is a period which is known as your fertile period or your fertile window. So to understand the days when you are most likely to be ovulating, you basically have to get a calendar, and then you have to do what we call charting your cycle. You can discuss more with your midwife or your doctor. They will help you chart your cycle. But the first method of tracking your ovulation, even if you have irregular periods, is you just have to get your calendar and then you begin charting your cycle. So the first method is you should know how to chart your cycle. Gerald Massa, the Health Educator, is the name of the channel. Let me know if you have any questions down below in the comments, and I will answer them personally. Next method of tracking your ovulation, even if you have irregular periods, is by doing what we call cervical mucus monitoring. Specifically, when a lady is in her ovulatory days, when a lady is ovulating, when a woman is ovulating, or when the egg is mature and it has been released. By the way, a mature egg is also known as a Graafian follicle. So when that mature egg or the Graafian follicle has been released, or when it is due to be released, there are changes that happen in the cervical mucus. Specifically, when we look at this chart, when you're detecting ovulation from cervical mucus, when you're not ovulating, your cervical mucus is normally dry or sticky. And then, if at all ovulation is coming closer, if at all you're nearing the days of ovulation, then your cervical mucus becomes wet and watery. So when we talk about monitoring your cervical mucus, you should understand that it becomes dry and sticky when you are not ovulating, and then when ovulation is close. Thanks a lot, my friend, for staying around. We are talking about cervical mucus, and we are saying that when you are not ovulating, normally the cervical mucus is dry and sticky, and then when you are about to go into ovulation, or when your ovulation days are close, then your cervical mucus becomes wet and watery. Also, to understand the difference specifically, you just have to say that you just have to understand that when your cervical mucus becomes wet and then watery, then that means ovulation is very close. Now, your cervical mucus can become very wet, even stretchy, and even it may resemble raw egg white. If at all your cervical mucus resembles raw egg white, then specifically it means you are now ovulating. So, in talking about cervical mucus monitoring, specifically, just understand that when it is dry and sticky, you're not ovulating. When it is wet and watery, ovulation is close. It is nearby, let's say 1 or 2 days. And then when your cervical mucus becomes very stretchy, just like when you get an egg and then you prepare that egg in a cup, and then that egg white, if your cervical mucus becomes like that, then you are actually in ovulation. So, second method of tracking your ovulation, even if you have irregular periods, is just take a closer look at your cervical mucus. The changes that happen in your cervical mucus will tell you that yes, this is ovulation or it's not ovulation. Let me know if you have any questions down below in the comments. I will be able to answer all your questions. Remember, we talked about the first way of tracking your ovulatory days is that we said that the first method of tracking your ovulation is by charting your cycle. The next method is by monitoring your cervical mucus. So we are going to move on to our next method of tracking your ovulation, even if you have irregular periods. Remember to subscribe for new videos every day so that you do not miss any videos. The next method is by tracking or by doing what we call basal body temperature. Basal body temperature monitoring. It kind of resembles the first method we talked about of charting your menstrual cycle or charting your cycle and understanding how your cycle moves. But in this particular case, still we use a calendar, but we pay close attention to the body temperature. You realize that when you reach your ovulatory days or when ovulation is about to reach, normally your body temperature tends to rise. It actually rises up to the peak. So if your body temperature rises up to the peak, that period when your body temperature rises, that is basically when you are most likely to be ovulating. But caution has to be taken into hand. You have to take caution because the rise of your body temperature could also indicate a medical illness. It could also indicate a disease. So if you have been experiencing issues like maybe you've been having other medical conditions and your body temperature rises, do not sit at home and assume that now you are ovulating. It could be a medical illness. You need to have your doctor check you. You need to go and see your doctor. But if you've been fine and then all of a sudden 2 to 3 days, let's say on the 14th day, or depending on your cycle, remember we are talking about irregular cycles. If all of a sudden your temperature rises, then you might have to really consider this more so if you've been charting your basal body temperature. So monitoring your body temperature is our third method. It's our third method of understanding or tracking the days when you are most likely to be ovulating. The first method we said is that you have to chart your cycle. Next method, we said you have to understand and monitor your cervical mucus. Dry and sticky, it means you're not ovulating. Wet and moist and slippery and even very stretchy, that means ovulation. Next, we talked about body temperature, and we said that when your body temperature rises, notice that period when your body temperature is at the peak. That is most likely your ovulatory days. Ask me all your questions down below in the comments. I will answer all your questions, and remember to like and share this video with your friends so that many of our friends get this information. So next method of tracking your ovulation, even if you have irregular periods, is by using what we call the ovulation predictor kits. The ovulation predictor kits specifically are strips that are made to look for a hormone known as LH, or luteinizing hormone. Although there are some testing kits, ovulation predictor kits, which also look for a hormone known as estrogen. Actually, that is even much better if you can get those ovulation predictor kits which look for the two hormones. That is the luteinizing hormone and then estrogen. The main reason is that these tend to be much more sensitive than the ordinary testing kits or the ordinary ovulation predictor kits, which look for only LH. Why are we talking about LH and then estrogen? These two hormones are very key. They are very important in a woman's process of getting pregnant, because when a lady is about to go into her ovulation, or when the day of ovulation is about to reach, the two hormones we are talking about, that is luteinizing hormone and the estrogen hormone specifically, they tend to rise. The main reason of them rising is that they prepare your uterine lining for the baby or for the fertilized egg that is going to come, and then of course following up with successful implantation. So the two hormones we are talking about specifically are involved in preparing your reproductive system or your uterus for implantation that is due to happen. So the ovulation predictor kits are our last method we've talked about on how to track your ovulatory days, or how to track your ovulation even if you have irregular periods. So as a summary, we are going to go through again. We said that the first method of tracking your ovulation, even if your periods are irregular, is you use what we call charting. You chart your cycle. Get a calendar and then begin tracking. Even if your cycle runs for 5 days, 10 days, 20 days, 27 days, or even 30 or 35 days, just get your calendar and then track. With time, you will notice some similarity. You will notice changes that do happen when you are about to go into your periods. The next method we talked about is, we said you do what we call a cervical mucus monitoring, and then we said that you look at the viscosity, you look at your cervical mucus, whether it is dry, and when it is so dry, then it means you are not ovulating, and when it is wet and moist, then it means you are ovulating. Next, we said you monitor what we call your basal body temperature, and we said that when your temperature rises, those days when your temperature is high, that is when you are most likely to be ovulating. And then lastly, we said that you do what we call monitoring you use what we call the ovulation predictor kits, and we said that these are testing kits specifically designed to look for the two hormones, that is the luteinizing hormone and then the estrogen hormone. These are very important in helping a woman or in preparing for a successful pregnancy. Remember, these kits are different from the urine pregnancy tests. The urine pregnancy tests specifically look for the HCG hormone, that hormone that is produced when now pregnancy has happened, when fertilization has happened. So when you go to your pharmacy, you should be very specific. You should be very specific in what you are telling your pharmacist what you want to buy. You should tell them you want what we call the ovulation predictor kits, and this is a sample of how they look, but depending on the manufacturer, they could actually be having a different way of looking, but specifically, as long as they are called the ovulation predictor kits. And we said that the ovulation predictor kits specifically look for the 2 hormones. Although there are some on the market which look for 1 hormone only, that is estrogen, that is luteinizing hormone alone. So we said that it would be much better if you got those which look for the 2 hormones, that is the luteinizing hormone and then estrogen. Thanks a lot, and remember to subscribe to our channel for new videos, and please remember to subscribe and like and share this video on all our social media platforms so that many of our friends can get this message and also benefit, because understanding what is happening to your system helps you a lot. It gives you a step. It gives you a step towards to understand where you're going, and specifically when changes are happening, you have irregular periods but you're not getting pregnant. This information might help you. But also remember to leave your questions down below in the comments. If you would like to connect with me, I can talk to you personally. You can connect with me. Add my number on your WhatsApp. My number is +256 701 79 78 and 76. That's +256 701 79 7876. Connect with me on my WhatsApp, add my number, and then you'll see my profile. We shall talk more in case you would like to have a private consultation or a private discussion. Gerald Massa, the Health Educator, is the name of the channel. You can also find me on all my social media, Gerald Massa, the Health Educator. And thanks a lot for staying with me. Subscribe for new videos. I put out new videos every day. I talk about women health. I talk about ultrasound. I talk about reproductive health. Remember to subscribe for new videos, and may God bless and protect us all. And please remember to subscribe. Connect with me on my WhatsApp. Remember, have yourself a fantastic day. See you in my next video, and may God bless us all. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald Massa, the Health Educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. HCG levels, there's increased alpha fetoprotein levels, there's severe fatigue, and then also the movements will be increased, and then there are also other things which can be detected, but still what you need to do is you should do an ultrasound scan to go ahead and confirm that yes, this is a twin pregnancy. Gerald Massa, the Health Educator, is the name of the channel. I thank you, my friend, for watching today's lesson. Remember to subscribe for new videos we release every day. Like, share, and hit the bell for notifications so that YouTube will show you the new videos we put out every day, the new videos we release every day. On this channel, we talk about pregnancy, we talk about the ovulation calendar, we do talk about women's health. Have yourself a fantastic and healthy day. May God bless us all, and see you in my next video tomorrow at exactly 17 hours. Bye bye, take care, God bless, bye. Hello, welcome to our channel. I'm Gerald Massa, the Health Educator. On this channel we talk about pregnancy related questions. We answer answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. on how you can go about this, the solutions on how you can get pregnant faster. Gerald Massa, the Health Educator, is the name of the channel. I welcome you and thank you, my friend, for staying with me for today's lesson. And remember to check back tomorrow for another video. And you could also let me know down below in the comments what videos, what lessons you would like me to cover, what topics you would like me to cover. See you in my next video, and may God bless and protect us all. Bye bye. Hello, welcome to our channel. I'm Gerald Massa, the Health Educator. On this channel we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. About pregnancy, about women's health. On this channel we talk about fertility, we talk about women's health. Remember, if you have any questions, I will be very glad to talk to you. Connect with me on my WhatsApp. It is +256 701 7978 and 76. You can also connect with me on my other WhatsApp number. It is +256 787 668 962. Ask me all your questions. I will answer all your questions. I will recommend to you the best advice, and then also may God bless and protect us all. Remember to subscribe for new videos. We put out videos every day on this channel. We talk about pregnancy. Many of our clients are appreciating, they are sending feedback on my WhatsApp. Even here on YouTube, you can go through the comments. They are appreciating the advice. We really believe that when information is good, it should be shared. So remember to share this with your friends. Share our channel so that many of our friends can get to know the same advice you are getting today. Thank you for all my subscribers. I'm really so thankful. The channel is growing. We thank God for the knowledge. We thank God for the blessings. And I'm also praying for you, my friend. If you are trying to get pregnant, I'm praying that may God grant you your wishes and may happiness prevail. So remember to check the description for details if at all you actually would like to know more. And please remember to join me on WhatsApp. I'm doing free consultations. The advice I'm giving you is really very key. Remember to connect with me on WhatsApp. Talk to me and I will be very excited to talk to you. Description for details. It's having everything you need to know about today's video. We have answered the question, can you have fertile cervical mucus but not ovulate? The answer is yes, and it's normally due to some causes, and this can include polycystic ovarian syndrome or hormonal imbalances or dysfunction in your anterior pituitary gland or hypothalamus. Lots of questions can be answered. Join me on WhatsApp so that I can answer all your questions. Thank you, my friend, for joining me for today's lesson. Have yourself a fantastic and healthy day, and God bless. Bye-bye. Hello, welcome to our channel. I'm Gerald Massa, the Health Educator. On this channel, we talk about pregnancy-related questions. We answer all your pregnancy-related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. The ovulation calendar, get pregnant faster, the complete guide. Ovulation calendar, get pregnant faster, the complete guide. This is my new ebook. It talks about ovulation. It talks about all the rules you need to follow, everything you need to follow if you are looking at getting pregnant. Get your ebook right now. Order for it on my WhatsApp. You can send me a message. It is +256 701 7978 76. You could also send me a WhatsApp on my other number. It is +256 787 668 962. Order by email. Also, you can send me an email on ovulationebook@gmail.com. That is ovulation ebook at gmail.com. Get your ebook right now. If you are looking at getting pregnant, you will read it. There are lots of steps to follow. They are easy to understand. Get this ebook right now. It goes for only $20. Order for your ebook at only $20. Send me a message and I will show you how you can purchase your ebook. When you get this ebook, you'll be able to determine ovulation. You'll understand the common problems with ovulation, the common drugs for ovulation, and then also you'll be able to improve male fertility, because you may be thinking that you have issues when there are issues with your partner, when maybe he has issues with low sperm count, poor sperm quality. So I talk about all this in this ebook, and then also you'll be able to determine, you'll also be able to have sex, and then of course to determine gender selection. You'll be able to time sex for gender selection, and then also you'll be able to have all your questions answered about ovulation. Get this ebook right now, because the biggest problem most women seem to have with getting pregnant is determining when they are ovulating and then their most fertile time to be pregnant. In this ebook, I've got all this covered. Just order for your ebook today and you will be able to know, you'll be able to begin on this journey of getting pregnant very easily, knowing that you have a guide, you have a book you are reading, and it's giving you tried and tested information which has worked for many women. It has worked for many couples. Get your ebook right now. To order, send me a message on +256 701 7978 and 76. That is +256 701 7978 76. You could also send me a WhatsApp on my number. It's also +256 787 668 962. Send me a message showing your interest, and I will show you how to order for your ebook, how you can purchase it. It will be delivered straight to your email once you submit all the details, and then also you could send me an email on ovulationebook@gmail.com. Get your ebook right now. Ovulation Calendar, Get Pregnant Faster, the complete guide. It goes for only $20. Gerald Massa, the Health Educator, are my names, and please connect with me and you will be able to get this ebook. Have yourself a fantastic and healthy day. Bye bye. One 797876, and the other WhatsApp number is +256 787 668 962. That is +256 787 668 962. Remember to connect with me on my WhatsApp numbers. Due to the large number of clients I handle, what you have to do is you submit your question, and then I will answer your question as soon as I get your question. I just request humbly, I request kindly that when you submit your question, I may not be on WhatsApp at that time. I may be at hospital, but still, as soon as I come back on WhatsApp, I can answer your question as soon as I see it. I'm so happy, and remember to read my book. The link is in the description. The book is titled The Ovulation Calendar, Get Pregnant Faster. Go to the description of this video, you click on that link, go to the page, sales page, and then look at it. And if you are a couple, you have tried to get pregnant for long, then that book is for you. This book is very good. It will help out. Thank you and have yourself a fantastic day. May God bless us all. Bye bye. Hello, welcome to our channel. I'm Gerald Massa, the Health Educator. On this channel, we talk about pregnancy-related questions. We answer all your pregnancy-related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.